My name is Peter Kelly. I'm an occupational health psychologist, an ex-inspector with 25 plus years at the Health and Safety Executive, where I helped shape national policy on workplace psychological and mental health. I'm also part of the original drafting executive for ISO 45003, covering psychological health and safety at work, and the recent convener of the drafting panel for British Standard 30480, which is the suicide prevention standard produced for the UK. And I have been commissioned by the Royal College of Veterinary Surgeons to produce alongside Sarah the new RCVS suicide prevention resources. Both Sarah and I were involved in the development of the workplace suicide prevention standards that have informed this work. Let me get Sarah to introduce herself.
Thanks, Peter. My name's Sarah Ambrose. I'm a business psychologist and workplace consultant in mental health and suicide prevention with over 20 years commercial experience in both public and private sector organisations, both nationally and internationally, and was recently a member of the drafting panel for BS 3480, our first standard in suicide prevention in the workplace.
Okay, in this session we will introduce the new RCVS suicide prevention resources developed to support veterinary workplaces in meeting the updated PSS requirements. We will explore why these resources were created, how they align with the RCVS standards and BS 30480, and more importantly, how they're intended to be used in practice. This is not about expecting you to become mental health experts. It's about creating safer systems, clearer pathways of support, and workplaces where people feel more confident recognizing concerns, responding compassionately, and accessing help when needed. We will walk briefly through each of the resources. The focus is practical, what each document is, who they are designed for, and how they can support both organizational implementation and everyday practice across veterinary teams.
Why this matters. These resources were developed in response to the introduction of the new practice standard scheme regarding suicide prevention requirements and the recognition that many veterinary workplaces wanted clearer, more practical guidance on how suicide prevention can be approached safely, proportionately, and effectively in practice. While awareness around mental health and suicide has increased significantly in recent years, there remains a gap between awareness and implementation, particularly around organisational responsibility, workplace risk factors, crisis response, and psychologically safe systems of support. The veterinary profession in particular also faces a number of unique occupational risks, including exposure to trauma and euthanasia, lone working, access to lethal means, high emotional demands, and professional isolation. These resources were therefore designed to provide an evidence-informed, structured framework that helps practices move beyond intention into practical action, embedding suicide prevention into leadership, workplace culture, risk assessment, training, and everyday responses.
So these resources are designed to work together as a layered and a practical framework for suicide prevention within veterinary practices and workplaces. The first is the toolkit. This provides an overarching organizational framework. It supports practices in understanding their responsibilities around governance, workplace risks, leadership, training, crisis response, and continuous improvement. And it helps translate the PSS requirements into practical implementation. The second is the workplace guide. This is designed for all veterinary professionals and provides clear, accessible guidance on recognizing concerns, responding proportionately, and understanding what to do from low-level concerns through to immediate risk. And the third is the checklist, which supports both practices and assessors by helping organizations to understand and review what is currently in place, identify gaps, evidence progress, demonstrate that suicide prevention arrangements are embedded with everyday practice and workplace systems. Collectively, these three resources are intended to increase confidence, create greater clarity around roles and responsibilities, and help veterinary workplaces move from awareness into structured, sustainable action. I'm going to pass you to Sarah to give more details on the toolkit.
Okay. The toolkit is the primary implementation document and provides the overarching framework for suicide prevention within veterinary workplaces. It's designed for those with responsibility for putting suicide prevention arrangements in place and for all staff as a reference point for understanding suicide prevention and how it is approached and supported in their workplace. The guide is structured across 7 core sections covering areas such as roles and responsibilities, workplace risk assessment, psychological safety, crisis response, confidentiality, intervention, training, and continuous improvement. Importantly, the toolkit is designed to be a practical and proportionate document. It helps practices move beyond intention into clear operational systems and processes. And in the toolkit, we identify the following process of how it is to be utilised. Planning, we talk about identifying what needs to be done. The implementation, putting the systems, training procedures and documentation in place. Review, assessing whether your approach is working. Feedback from staff, learning, adapting and supporting. And the evidence, documentation of what you have done.
Now, the staff guide is deliberately simple and direct. It helps all veterinary professionals understand what to do if they are worried about someone. It explains when to act, what to say, and when to escalate, and where to find support. Importantly, it reinforces boundaries. Staff are not expected to become clinicians, therapists, or mental health experts. Their role is to notice changes, listen without judgment, and respond with compassion, and help connect people to the appropriate support. The checklist is a practical tool designed to support implementation, consistency, and continuous review. It acts as an action by action progress tracker, helping practices to understand what is already in place, where there may be gaps, and what evidence may be needed to demonstrate ongoing implementation and improvement. The purpose is to help practices and assessors explore whether suicide prevention arrangements are genuinely embedded in workplace systems and culture, not simply written into policy documents. Alongside the toolkit, it provides a structured way to review progress across all the key areas. Now I'm going to pass you over to Sarah to summarize the key takeaways.
Okay, a recap on the key takeaways. These resources have been designed to make suicide prevention practical, proportionate, and to enable them to be embedded within every veterinary workplace. They'll help you to understand workplace mental health through a whole organisation lens, be able to recognise the early warning signs in employees and colleagues, how to hold supportive conversations with confidence, You'll be able to apply policies, practices, and strategies that support being well in the workplace and look after yourself, managing your own self-care and personal resilience, being able to access appropriate workplace support and resources as well. The aim is not to predict risk with certainty here, but to reduce foreseeable risk, increase confidence, and create safer systems of support. Which brings me nicely on to the next steps, where I'll hand you over to Rupinder, who's going to talk to you about the resources available and next steps.
Here are some MMI courses on the RCVS Academy that provide further structured learning to support the suicide prevention resources. The RCVS Academy is our dedicated free online learning platform for veterinary professionals and can be accessed through logging into your RCVS My account. The Managing Mental Health in the Workplace course equips current and aspiring leaders with the knowledge and skills needed to effectively support mental health in the workplace. It explores the foundations of mental health and promotes a whole organisation approach to well-being. Participants will learn to recognise early warning signs and respond appropriately to employees' needs. The course builds confidence in having supportive, practical conversations about mental health. It also focuses on creating positive work environments through policies, practices, and leadership behaviours. The course highlights the importance of self-care for managers and how to access appropriate support and resources. The Suicide Awareness Fundamentals is an introductory course that builds foundational awareness of suicide, equipping participants with the knowledge to support colleagues with compassion and understanding. It explores key facts, myths, and risk factors, including those particularly relevant to the veterinary profession. Learners will develop confidence in talking about suicide safely, responsibly, and in ways that help reduce stigma. The course provides practical guidance on responding to disclosures of suicidal thoughts with empathy and clarity. It also highlights the importance of post-prevention support for individuals and teams following a suicide. Finally, it signposts important guidelines, resources, and support services for both those in crisis and those affected by loss. Both the RCVS Academy courses count towards your CPD requirements, as well as watching today's webinar. Don't forget to log and reflect on this session in the RCVS 1CPD app. We recognise that suicide can be a difficult topic to talk about, which is why it's important to know that support is available and you don't have to face it alone. Should you require support or need to signpost someone else, we encourage you to reach out to a GP or another trusted source of support, such as these helplines or text-based services shown on the slide. Many of these services are available 24 hours a day, 7 days a week, offering confidential, immediate support during difficult moments. Remember, signposting to the right support can make a meaningful difference and is an important part of supporting both yourself and others. For further queries about the PSS Suicide Prevention Standard, please contact pss@rcvs.org.uk.